Okay, well, hi to everyone who's joining us live and to people who maybe are listening to this recording later on. My name's Louise Holly, and I'm the Policy and Research Coordinator with the Digital Transformations for Health Lab, or DTH-Lab. And it's my real pleasure to be moderating the first part of this research dissemination series, where we'll be bringing 4 of our research fellows to you to present the work that they've been doing with DTH-Lab over the last year. Before we hear their presentations, though, I'd like to invite our Executive Director, Afrodita Bertucci, to give us a few words about DTH-Lab and the Research Fellowship. So over to you, Afrodita.
Hi, Louise. Thank you very much for the introductions and for being the moderator today. And thank you to everybody who's joining us. So as Louise said, I'm Afrodita Bertucci. I'm the Executive Director of the Digital Transformations for Health Lab. And where today's event is all about showcasing the incredible work that's been done by our research fellows and the impact they're making in the world of digital health. So at DTH-Lab, we are driven by a very clear and ambitious vision, which is that digital transformations for health are led by health for all values. And those health for all values will enable digital-first health systems to deliver equitable benefits for the health, well-being, and safety of young people and their communities. Now, this vision is inspired by the recommendations of the Lancet and Financial Times Commission. There was a report that was launched in October 2021 on governing health futures. And the DTH-Lab is a direct outcome of that Lancet and Financial Times Commission work. And we are committed to turning the ideas and visions and concepts from the report and the recommendations into reality. So how do we work? As a lab, we take a multidisciplinary approach to achieving our goals, and we focus on 4 key areas. You'll have the opportunity over the 2 sessions to hear about our different work streams. But in a nutshell, we look at building digital-first health systems, where we are co-creating them with and for young people. We're engaging them to harness their perspectives and ideas to ensure that digital-first health systems are responsive to their unique health needs, and also to empower them to become enfranchised digital citizens for health. We also look at in advancing value-driven governance of digital transformations for health, where we build trust in health ecosystems and maximize the public value and health benefits of data. We work together with partners such as University of Vienna in this case, and we develop and test governance frameworks, health guide, policy regulations for the use of digital technologies. Digital determinants of health is a term that was coined by the Lancet and Financial Times Commission, and we're exploring how digital technologies impact health outcomes. Again, this is something you'll hear from our research fellows. And last but not least, we look at digital citizenship for health, where we bring together with partners, we develop tools that involve the intersection and combination of digital health and civic literacy to empower young people to become informed digital citizens. So today we are here to look at our research fellowship program, to hear from our research fellows. And this is part of our strategy. We have a research fellowship program, which is designed to nurture the next generation of health leaders and researchers. So in 2024, we welcomed 9 talented fellows from Africa, Asia, and Europe who've been working on innovative digital health projects. So over the 2-part dissemination, first this one on the 25th February and the next one on the 5th of March, you will be hearing from our fellows and explore how their research can shape the future of health. Today specifically, we'll be hearing from Erza Selmani and Esther Opone, who will be analyzing the major global digital technologies companies' policies and strategies, which are relevant to health. We'll be hearing from Jyoti Chaudhary, who will be looking at digital determinants of health data trends, looking at global data on young people's health and well-being, and literacy and other indicators, and analyzing the available data. And then Preetika Banerjee will be looking at a review of the longitudinal studies that have examined the long-term impacts of digital transformation on young people's health and well-being. So again, I want to extend my heartfelt thanks to our research fellows for their dedication and hard work. Their contributions are invaluable to our mission, and I'm very excited to see how the research will impact the world. So again, thank you to everybody, and please, I invite our first research fellow to present.
Thank you so much, Avadita. So hopefully Avadita's kind of introductory words give you an overview of the different themes that we're working on at DTH-Lab. And as you listen to the 4 presentations, you'll be able to identify which of our work streams the research is feeding into. But broadly, we've brought these 4 presentations together today because they really contribute to our work on the theme of digital determinants of health. So you'll hear from Esther first, and then Erza, who have been looking at the policies and practices of digital technology companies, both at the Africa continental level and then at the global level. And the reason that they're looking into those companies is because we really believe that digital transformations in all areas of life are shaping our health and well-being. And some of these companies are shaping many different aspects of our life and having both direct and indirect impacts on our health and well-being. So first, I would really like to welcome Esther Opone, who is has a number of different roles, but she's a researcher, a product manager, and also president of the Africa Digital Health Professionals Network, among many other roles that she holds. So I'll hand over to you, Esther, to present the work that you've done looking at the policies of African digital technology companies. Over to you, Esther, and welcome.
Hi, thank you very much. It's a great pleasure to be here. I just want to confirm that you all can hear me.
Yes, we can hear you.
All right, thank you very much. So I'll jump right into it. Next slide, please. So basically, I'll be presenting on the African-based digital technology companies, and it's very important because the world really needs Africa-informed policies to shape our digital health and well-being, particularly because we have over 520 million internet users in Africa. So that means we have a very high digitally native population, and it keeps on increasing. And digital technology companies have a huge impact on the health and well-being of young people. People use them every day to access services, including healthcare services, as well as non-health services, like social networks for connections, tools for their day-to-day activities, and so on. And these impacts can be negative or positive, which depends on their strategies, their policies, and so on. It's quite paradoxical to also note that some of these impacts can be positive. What makes a digital technology platform have a positive impact can also end up having negative side effects. So great care must really be taken when it comes to using this platform. So the focus of this is to look at the content of the relevant policies and strategies by these companies, especially African-based ones, their policy strengths and gaps, and of course, to provide recommendations for youth-centric and African-informed policies. Next slide, please. So quick overview of my methodology was to break it into a 2-phase qualitative research process. So the first stage was actually a landscape analysis of whereby I profiled about 53 digital technology companies, aka DTCs, and of that were core digital health companies and then non-health digital health companies. And the rationale for including non-health was that while they do not provide healthcare services directly, they have an impact on the health and well-being of their users. Social networking, money lending, sports betting, among others, but I focused on these three. Then afterwards, I went on to a policy analysis of 15 of these initially profiled companies, and then used different things to analyze them, which are listed on the screen, and then they were scored based on some sub-themes under these things that were extracted from looking at different relevant global and regional frameworks. Next one, please. So my findings went across, next slide, please. My findings looked at the score, would show the scoring of how these different organizations ranked based on the themes under which they were analyzed. And it shows across the theme of user privacy and consent, how strong their policies were regarding data governance, health promotion, and special considerations and measures for young users. And some of the key things that you would be able to, I wanted to highlight in that was that the company that actually scored the highest was actually a non-digital health company, was actually a betting company. I think my guess is that this is maybe because, can you hear me?
Yes, Esther, we can hear you.
So while we wait for that to come on, I was saying that one of the major highlights of my findings was that it was a non-digital health company that actually scored the highest, that had the strongest scoring, a betting app. And I think it was because it's a very highly regulated sector. So that really influenced a lot. And then some of the gaps that I noticed were also, before the gaps, I noticed a lot of things regarding positives. A lot of them reference local, regional, and global frameworks, whether from their country or the EU framework, or for some health companies, for instance, they talked a lot about HIPAA guidelines and all that. For the loaning apps, some alluded to cautious debt collection practices, also responsible gambling, mental health support, content moderation, anonymous access, health disclaimers, and so on. Now, some of the core gaps that I noticed were around how vague some of the company policies were, which, for instance, even in the accessing the policies themselves on their website or their app or whatever it is, and then how readable they were and how transparent and comprehensive they were, in elucidating their policies. Also, some assumed a lot of user agreements just by the users continuing to explore their website, whether they actually signed up or not. And then you just find out that people were tracking you or cookies were following you. Also, there was lack of clear age verification processes and also limited attention to peculiarities, especially around emerging technologies like AI that they were using on those platforms as well. And then some inconsistencies with policy claims versus the actual provisions they made to have this policy be implemented. And so this has a lot of implication on users fully understanding what they were getting themselves into by using these platforms, and also being able to manage their expectations, which can leave room for distrust, as well as loopholes for exploitation by these digital technology companies. So in line with that, I have some recommendations for policy and practice and even industry, which is one, to improve and standardize minimal requirements for policy documentation and presentation, and for digital technology companies to also align to these minimum requirements. Of course, this actually needs to be a collaborative effort to make this standardization happen. So the policies should be readable, should be clear, should be engaging and user-friendly, enough of wordy documents, and vague use of words. And of course, consider responsibility across various gadgets, especially since a lot of young users use mobile phones. Also, going forward, research also look not just into the policies that were stated, but see whether they actually implement these policies end to end, that is throughout all of their processes, not just one part of it. And this would include talking to the identified users, of course, explore nuances for policy implementation. For instance, policy rules or data protection rules in Nigeria might vary from for that in Zimbabwe. And so companies that operate across these two different countries should be able to factor in those nuances of implementing their policies across board. And of course, other considerations include data minimization, collecting only the data that you need for the purpose that you need it for, and not just taking excess. Having more logic for techno stress and conversion, factoring in some cultural things, especially since a lot of African societies are heterogeneous and all of that. And for instance, in parental consent, as well as putting proactive controls within the hands of the users themselves, like self-exclusion, reporting, and so on. And finally, given that all the world of digital technology is evolving a lot, we need to be able to also be agile, right? Carrying on ongoing monitoring and adaptation to ensure that the policies can also evolve to meet the needs, as well as remain relevant and people can remain compliant. Thank you very much for listening.
Thank you so much, Esther. I wanted to just remind people that if you want to ask any questions to any of the presenters, you can use the Q&A function at the bottom of the screen on Zoom or the chat function, whichever's easier. So if anyone has any questions for Esther, please pose them now, because I know, Esther, you're not able to stay all the way to the end. And maybe while people are thinking about their questions, I would really encourage those of you who are interested in this topic to read Esther's paper. Her presentation doesn't really do justice to the depth in which she really explored the different sort of policies and instruments of these different digital technology companies operating in different parts of Africa. It's a very, very rich report with lots of detailed information for those of you curious to know more about the types of policies that different companies have and their different strengths and weaknesses. Maybe a question for you, I haven't seen any come up for you, Esther, is like you note that the digital world is constantly evolving. Policies can evolve rapidly, as you've put on this final slide, but so much has happened even in the last few months since you finalized your reports, for example, in relation to AI. Do you think that companies are going to be able to adapt their policies to reflect the way in which AI is sort of integrated into all of these different apps and solutions? And do you think that regulation can keep up with this?
Right, thank you very much. So I think that as a digital technology company, since I assume that the major role they want to play is to be able to provide solutions for the users, right, and all that. And so I think when we come to the point of acknowledging that AI is here to stay and that we need to be able to make sure that our use of AI or integration of AI into our systems or platforms add to everything, then it becomes something that we have to hold that this is an important tool of the trade. This is the expectation of us to be on ground and to make sure that just as the world of AI is evolving, we also have to stay on top of that and make sure that our use of it and then how we are protecting the users of our platform also reflects our care for them, because at the end of the day, we are supposed to be user-centric. So with that in mind, that would help us to be able to evolve as we need to, or maybe the term to use to be agile, right, as we need to. And this is the same thing with regulators as well. As opposed to seeing it as something to fight, we should embrace that this is here to stay. But now the question is, how best do we use it whilst protecting our people so we get to optimize and enjoy the benefits while minimizing the negatives it might have on the users across board.
Thanks, Esther. And I've just seen a question from Favor. Thank you, Favor. So he's asking, or she's asking, sorry, given the study's findings on gaps in transparency, age verification, and youth-focused policy measures, what specific regulatory interventions or standards do you think are needed to ensure that Africa-based technology companies are implementing stronger safeguards for young people's privacy and well-being? Thanks for that question.
All right, thank you very much. This is a multi-layered question, but I'll try to speak to it as much as possible. For instance, on age verification, I think we can also adapt across different industries. For instance, I know for financial technology companies, they do some things around know your customer, KYC. So for age verification processes, which can be vague, which you can just get to type in your date of birth, and then they assume that you are telling the truth and you are not a minor. Then maybe they could, policymakers could insist on, for people who use this platform, maybe putting a means of identification just to confirm, or something that links to your actual date of birth or something like that as much as possible. Now that also needs a balance, because I also spoke to data minimization, right? Collecting only what you need to. And then if that is what we need to actually verify the age of our user, then maybe we might need to do that. Also regarding transparency is rather than use vague words or bogus words that could mean anything or anything. For instance, one of the companies I saw had something about data selling and said, we have not sold your data to third parties in the last 12 months. So that leaves room for confusion, like you've never sold or you never sell, or does it mean that you have not sold in the last 12 months? So in the last 24 months, did you sell? Do you intend to sell going forward? So I hope that speaks to that question. Thank you.
That's great, Esther. Thank you. So if anyone else has any questions specifically on Esther's presentation, please put them in the Q&A and Esther can try and respond to them in writing. But we'll move on now to the next presentation. Thank you so much, Esther. We're now going to move over to Erza Selmani, who's a PhD student, a researcher, and also director of ICR-Lab in Kosovo. It's a pleasure to welcome you, Erza. You also were looking at digital technology companies, but also going up to the global level. So over to you to tell us what you learned about their policies and practices.
Thank you, Louise. Thank you, Louise, and thank you, Alfredita, first of all, for creating this platform where we can research on these topics, quite pressing and relevant topics, but also this whole dissemination event, which I am enjoying so far so much. Okay, so let me start by highlighting the kind of theme of my research. What we wanted to do with this research paper was to analyze tech policies for young users' health and safety. Why did we think this was important? It was three main kind of factors. First of all, the ever-evolving nature of tech and very rapid evolving nature of tech, which is making big tech companies to always seek for or always be alerted to adapt their strategies based on regulatory standards. And while sometimes they are this kind of rapid evolving is making regulatory standards not necessarily be able to keep up with the speed, and this is putting at risk privacy policies, or is putting at risk user privacy and consent, which remain and will always be at the cornerstone of big tech adoption. And the third factor, why we think this topic is important, is because there are always vulnerable users out there. One of these groups are young users who are very exposed to online activities, and so basically the adapting strategies, privacy policies, and young users as vulnerable target group are the kind of three main factors why we believe this topic is important. What are some of the aim and objectives, or what did we wanted to do? We started by reviewing major digital tech companies. We wanted to review the major digital technology companies and their platforms that are somehow inflicted with digital health services, either directly or indirectly. But then we also wanted to add some mobile applications that fall within the health and well-being category and that are very heavily used. Then we wanted to select few of the most kind of relevant platforms and go more in depth with them to understand or better understand their privacy policies with a particular focus on young users. And so how did we do this? We started by searching on the most reliable platforms for the biggest tech companies, and we selected a few of them from Forbes Global 2000 and the other platforms. Then we also searched on Apple Store for top health mobile applications from the list of 200. We selected those with the highest ratings. So we ended up with the list on the next slide. So we wanted to look at Google, Meta platforms, Samsung, ByteDance, Snap, X-Corp, and OpenAI. This was because we deemed these were the most relevant. They were actually kind of the biggest big tech companies in all those platforms that we looked at. But we also added the mobile apps such as Strava, Flow, Sleep Cycle, Better Me, and Headspace, Talkspace, Noom, and MyFitnessPal. So we reviewed all of these individually. We also reviewed their platforms. For example, if we say we reviewed Meta platforms, yes, we did that, but we also reviewed Instagram and Facebook individually. And then we kind of came into the conclusion that Facebook, Instagram, TikTok, Snapchat, and YouTube are kind of the most relevant platforms to look more in depth into how they conduct themselves in the digital health era space for young users. We added ChatGPT, and the reasons for this selection, despite of the huge user base and younger user base, it was because some of their features also are being considered as features that encourage excessive use with its persuasive design, such as TikTok with bite-sized content and infinite scrolling, Facebook and Instagram with the scrolling and reels, Snapchat with snap streaks, and ChatGPT because of its very high relevance in the past year, but also because it enables users to seek for very specific and very tailored health advice, which is not often reliable or misses context. Then after we kind of selected these companies to look more in depth into, we used the didactic thematic analysis with predefined themes such as data collection and usage, data privacy, compliance with laws and regulations, and young user safety on the internet. We went on these platforms' websites and went through their privacy policies, but also searched on relevant journal articles and gray literature between September to November 2024. And then we came up with these results. I'm just going to go quickly on a few of the main points. In terms of data collection, so all of these platforms collect very extensive data, starting from personal information, name, last name, age, gender, and address and everything. But they also collect data of our daily activity with these social media platforms. How are these data being used? Mostly used to influence decisions and fuel addiction. ChatGPT uses data mostly for research purposes and model improvement. However, all of these platforms under this review have been used this data for performance improvement, service improvement, and sometimes fraud detection. These AI models that are being kind of developed or kind of improved based on this data often has turned out to be discriminatory. There have been cases where, let's say, ChatGPT makes assumptions whether you are of a specific gender just based on your name, or ethnicity or race, or any other factors. How do these companies or platforms share their data? With who do they share their data? They share this data with advertisers, partners, or third parties, and authorities in any case, or requests from higher up instances. However, it was one of my comments in the paper that they are not very specific enough of who are these advertisers and who are these partners, which kind of leaves a big question mark in terms of transparency. how secure and how protected is our data. All of the platforms claim, or based on their privacy policies, all of the platforms provide encryption, two-factor authentication, but also threat detection systems. However, Meta has been fined in the past for mishandling data in 2019 in a scandal where even if users have opt-out of sharing their data, one of the big companies was able to access this data and use them. Now, how compliant these platforms are with the regulations in place? All of them are compliant with GDPR. Social media networks under this review are also compliant with Children's Online Privacy Protection Act, while OpenAI is working towards that. YouTube has developed this new product or kind of separate product, which does not only comply with COPPA standards, but it was designed to comply with COPPA standards, which has taken a step forward. However, despite that they say they are compliant, or despite that their privacy say they are compliant, these kind of the mechanisms that they have in place to comply are sometimes easily bypassed. One of the examples is the age restriction. All of these platforms say that they are not allowed to be used under the age of 13 years old, but they rely on self-reporting age information, which can be very easily bypassed. TikTok has been fined in the past for allowing users younger than 13 years old to join their platform, and then when other users flagged these accounts as underage, TikTok did not take any measures to kind of fix that. However, all of the platforms, apart from ChatGPT, provide parental tools. They are quite not very easy to navigate, and especially for those with less digital literacy skills. Some of the key recent initiatives for young user safety have been TikTok banning the beauty filters for teens, Australia's bold move to ban all social media under the age of 16, placing the responsibility on the platforms or companies, not on the user, and YouTube restricting idealized content exposure for body image and self-image. While we don't believe that Australia or banning social media is the kind of solution, we believe that there should be some measures taken, and some of them could be implementing privacy by design and default, following the example of YouTube Kids for younger ages, empowering and educating young users on the risk of social media, and ensuring transparency and customization. So let me conclude my presentation by saying that there is a great need for a safer online environment for young users. Thank you very much.
Thank you so much, Erza. It's really interesting that I think, along with Esther, like you both found, I thought, reinforced the fact that technology companies, even when they're not specifically focused on health and well-being, like their practices play such an important role in shaping our health and the health and well-being of those who use these services. And it really seems like from both of your findings that the way that these companies are handling our data is such an important element of that. And I really liked in your report, Erza, you wrote that data is a massive power weapon that's being used for targeting marketing, advertising, and personalized content. That was a very powerful kind of statement from your paper. And I don't know if anyone else wants to ask you any questions, please put them in the box. But I wanted to hear from you, like, after having done all of this research, like, do you think it's really a choice now for us? We either hand over all of our data to these companies and accept that they're going to do what they want with them, or is it we don't use them and we protect our own privacy? Like, do you think that is a choice, or can we kind of get that balance where we can enjoy the benefits of these kind of products, but also protecting our own privacy as well?
Okay, that's a really good point, and I think that's the kind of the big challenge of this current or of this century maybe, because it's difficult to reach that balance where these business interests are being met while we also benefit from it. Yeah, but however, I think that it's important to have some responsible use of our data, but also users to be educated and empowered to make that decision whether they want to give away their data or not, and not do it just because they are not aware of how their data is being used or who it is shared with, or how to kind of disable sharing your data. It seems like these big tech companies are more kind of, they have shown to be more reactive rather than proactive in taking measures. So I think that it would be important to have stricter enforcement of the regulations together with digital literacy skills and users kind of mindset shift. I think that would be kind of a balance for now.
Great, thanks for that. And I see there are some questions for you, Erza, in the Q&A box, but because of time, would you mind kind of responding to those, the ones that you feel comfortable in writing, and others can do that as well. But yeah, thank you so much for the presentation. Hopefully there'll be time for more questions, but I'd like to move us on over to Preetika Banerjee, who is a PhD student based in Seattle. So I think we can all acknowledge you for being here at a really horrible time of the middle of the night. Thank you so much for doing that. So Preetika, you have been looking into longitudinal studies about the impact of digital technology use on young people's health and well-being. And that's a kind of direct response to the Lancet and Financial Times Commission report that Afrodita mentioned in her opening remarks, where the Commission called for more longitudinal research on how technology is shaping us. So over to you. Please tell us what you found out.
Yeah, thank you so much, Louise. Thank you and Afrodita and the DTH-Lab for allowing me this opportunity to dive into this kind of research and also present in this platform. I'm really excited to follow Esther and Erza's presentations, which bring out really important topics about how we should be considering the use of digital media in today's world. And so I'm excited to present on my research, which looks at a scoping review of existing longitudinal studies. So in this research, my aim was to kind of identify and synthesize and analyze existing longitudinal data, looking at the relationship between digital interventions and health and well-being of people. I think, as Erza very distinctly pointed out, that digital technologies are rapidly changing, and therefore trying to identify their longitudinal effects on people is a very challenging topic, and therefore we were curious to identify studies that is looking into this, and also addressing what these technologies can do to people's mental health. So a longitudinal study, just as a quick refresher for people, is a study that looks at repeated measures of a single outcome over time. So just trying to understand how that takes place. Yeah.
Oh, have we lost Preetika? We have. Okay, let's give her a second to see if she comes back. Otherwise, what we'll do is we will move over to Jyoti and then come back to Preetika. So okay, let me introduce Jyoti so you can get ready just in case Preetika doesn't come back. But following Preetika, we're going to have Jyoti Chaudhary, who is a research analyst and also a PhD student in India. She's also a teaching fellow at Ashoka University. Jyoti was also looking at the topic of digital determinants of health, and sort of her project was very data focused, so looking at what kind of data exists for India, and also she did explore beyond India as well, but in like how do we measure digital inclusion, digital access, because we can increasingly understand now that having access to digital technologies is a determinant of our health and well-being. So we wanted to understand what kind of disparities exist. What did you find in terms of the data that's available on digital access and other indicators for India?
So thank you, Louise, Efferdita and DTH-Labs for making me a part of this wonderful project and also for organizing this dissemination series. And thank you everybody who's present here and took time out to be with us and listen to us. So as a research fellow at the DTH-Labs, I've been working on understanding the digital inclusion and youth health, mainly focused in India. So we all know that globally, digital technology is reshaping sectors, including healthcare, and with innovations like mobile health platforms and telemedicine bringing significant improvements to service delivery and access. However, challenges persist, so particularly in ensuring equitable access and inclusivity for all. Disparities in digital literacy, connectivity, and infrastructure can limit the reach and effectiveness of these technological solutions, leaving some populations underserved. And these challenges resonate really strongly in India, a country with one of the largest youth demographics. And when I say a country with the world's largest youth demographics, I mean that India's youth population stands at 371.4 million. People who are in the age group of 15 to 29 years. And when compared to the global youth demographics, we see that the percentage share of youth population in the total population for India is 27%, compared to around 15% globally. Now, for any digital technology to make significant strides, the basic infrastructure is required is in the form of availability of mobile phones, computers, and internet. Now, this is some data provided by the Ministry of Statistics and Program Implementation in India. It highlights the digital literacy, which is one of the important digital determinants of health. Among the youth in India. This data is for 2017-18, and it shows that the overall digital competence for the youth in India is not very high. More than that, what we really need to look at is that there is a stark difference among the males and the females by their ability to operate computers and by their ability to use internet. So these are the two indicators through which we look at the digital literacy among the youth. So we see that while around 40% of males are able to operate computers, it's only 27% for the females. Similarly, there's a large gap in terms of their ability to use the internet among the females. Next slide. Yeah, so before we move on to the next slide, we must take note of the fact that although the overall digital competence shown here is not very high, but this data is for the 2017-2018 year. And over the last one decade, Indian government has really pushed forward teaching of inclusion of digital literacy across among the youth. So it has been really pushed, and these figures, if we look at for the current year, I'm sure would be high. However, the gender difference still persists, but the data that was available was only for these years. Now, here what we look at is another really important digital determinants is the use of mobile phones. So we look at the share of Indians using mobile phones. This is very recent data for the year 2023. And what we can see is that the penetration of mobile phones in India has been quite high. The graph shows that share of Indians using mobile phones across different socioeconomic indicators. The blue bars are for the women and the red bars are for the men. So one thing that is very clear from this graph is that the red bars, the ones for the men, are always higher compared to the women. So the share of men using mobile phones is higher compared to women across all socioeconomic indicators, be it age, education, income quintile, or region. Now, if we look at the age groups, we can see that the age groups from 15 to 45 years are the ones where the penetration is higher compared to the age groups 60 and above. if we look at across education, we see that as the attainment of education increases, as we move from illiteracy to primary, secondary, and then higher education, the penetration of mobile phones is higher for the ones who are highly educated. Also, the difference between the men and the women's access to mobile phones reduces as they attain more and more education, as they attain higher and higher education. If you look at the income quintiles, we can see that again, as we move from the lowest income quintile to the higher income quintile, the access to mobile phones increases and the difference across the gender also lowers. If you look at the region, we can see that in the urban areas, the access is slightly higher compared to the rural areas. Now, this graph here, it shows us the share of Indians using the internet. One thing is clear that although the penetration of mobile phones has been really huge in India, the internet is still not that widespread. The use of internet is still not that widespread. Again, if you look at across the age categories, we can see that it is the people in the age group of 15 to 45 years who are the ones who have the most access to the internet compared to other age categories. Similarly, people who are highly educated, who fall in the rich income classes and who live in urban areas are the ones who have higher access to internet. Now, if you look at the offline, so what is the offline population? So in the same survey from which this data has been retrieved, respondents were asked if they had ever used a mobile phone or internet at least once in the last 3 months preceding the date of the survey. And you can see that although the proportion of population which has neither used a mobile phone nor internet is now shrinking, is small, but still it exists and it's higher among the women. So it's the yellow bars. So in the women, we can see that 21% women reported to have not used either mobile phone nor internet in the last 3 months, whereas it was less than 1 in 10 men which reported the same. Again, it highlights the gender disparity. What are the key takeaways? So although India has made remarkable progress in expanding digital infrastructure, significantly increasing the mobile and internet connectivity, however, this progress remains unevenly distributed. There are urban-rural disparities, there are socioeconomic inequalities, and their difference in educational attainment, they create a complex digital landscape. And to ensure that the benefits of digital health transformations reach everyone, a tailored and an inclusive approach is essential. Also, just a minute on this. So there are certain critical data gaps that exist, data which if would have been available, we could have been able to do a more comprehensive study of the impact of digital determinants of health and its impact on youth health. So specifically, if data was available on quality of digital access, on digital health service access, and health workforce trained for digital health initiatives. Also, if data was available on digital health applications, their utilization rates and their perceived effectiveness, we could have been able to do a more comprehensive study. And moving forward, I feel these are some critical data gaps that the researchers and the government that they need to look at for future. So thank you. That's all.
Thank you so much, Jyoti. I think we're probably all expecting there to be some kind of disparities in terms of access, but it's really quite shocking to see, particularly the gender disparities in India. And it really shows that even when we have the infrastructure and availability of technologies, there are so many different barriers that are preventing women, rural communities, and others from benefiting from digital health solutions and others. So thank you so much for putting all of that data together and analysing it for us. We're running short on time, so I really encourage people to both read Jyoti's paper and to put any questions in the chat for her. Hopefully, if we have time at the end, we'll come back and ask you some more questions, Jyoti, but I want to see if Preetika's back, if we can hand over to her to finish her presentation.
Yes, I'm back. I'm so sorry about that. We're having a wind advisory here and we just lost power.
So while we do that, maybe Jyoti, you can share some reflections in terms of what do you think needs to be done to overcome some of these gender-related barriers in India so that women can access equally to digital technologies and we can see some shifts in these graphs?
So, yeah, thank you for the question. So, I guess we need to really work on the socioeconomic dimensions where women are really lacking, which contribute to women not being able to access the digital determinants, the digital technology. So, especially I think in terms of education. So, not only educating women, but also I think digital education, digital literacy should be introduced in the curriculum in this at the school level itself. So I think education is one where we really need to push forward. We really need to work. The other is that the accessibility of devices is also accessibility to any form of technology is also a big problem. It's a big challenge for women. There was some data which looked at sharing of mobile phones and computers at homes, and it's actually the women who are mostly the shared users. Again, so it's education and it's accessibility. So those two factors really need to be looked at.
Thanks,
you.
Jyoti. Can we get Preetika's slides up, and then over to you, Preetika, to continue your presentation on longitudinal studies.
Thank you so much. So going back to where I dropped off, so this study, we conducted it in 3 phases, starting with developing search strategies, identifying studies, next analyzing those studies and identifying relevant themes, and then looking critically at the studies under each theme, and identifying gaps and future areas for research. So to develop the search strategy, which was the first phase of this study, we first looked at available databases, starting with whatever was open source. So we looked at PubMed, Embase, and PsycNet. These were kind of the 3 open source resources we could use to identify studies. And we used the PICOTS framework, which is common in healthcare research, to identify these studies, which looked at patient intervention, comparator, outcome, timing, and setting. So for this study, we didn't have a comparator or an outcome, but we looked at patients, which were young people, adolescents, and then the intervention we were looking at was digital technologies. The timing was over the past decade. And the setting was looking at longitudinal studies. Overall, on a high level, we were able to identify about over 250 studies that looked at longitudinal effects of digital technology on health for these adolescents and young people. In general, we were able to see a large number of studies being observational, with about 40% being interventional as well. What was interesting to find, we had hypothesized finding a lot more technologies to be having negative outcomes, but it was interesting to see that we did have studies with positive or neutral outcomes. A fair amount of these studies were focused in the global north, with only 15% of these studies being focused on the global south. We were able to identify 6 main themes from these studies, with a large proportion of the studies being concentrated in theme 2, which is the digital addiction and behavioral outcomes theme. In each of these 6 themes, we had sub-themes. So in social media use and mental health, we looked at anxiety, depression, general risk behaviors online. In digital addiction, we were looking at gamification of exercise, general physical activity improvement, and then we looked at how digital health interventions can improve cognition through educational platforms. We also looked at parental influence and how parents could play a role in moderating their children's use of digital technologies. And lastly, we also saw how digital well-being can be linked to risky behaviors of adolescents. In conclusion, we saw that there is a very strong association between digital media use and mental health. And these are very context-specific and nuanced effects that need to be studied in more depth, particularly in the global south. Additionally, to develop interventions around these findings, it is important to make sure that these interventions are context and population specific. and make sure that we can enhance the positive use of social media, especially among risky adolescent groups. Thank you.
Thank you so much, Preetika. And again, the presentations in just a few minutes doesn't do justice to the amount of work that is behind this. So please do take a look at the full paper from Preetika. Again, if there's any questions, please put them in the Q&A in the few minutes we have left. But I would love to hear from you, Preetika, like if you were now able to design your own longitudinal study to look into the health impacts of digital technologies, like what would you want to look at?
Thanks, Louise. That's a really interesting question. I think what emerged for me was that we saw that a lot of these studies do have positive outcomes. And so if I could design my own study, I would like to look at the sustained mental health improvement of the use of these technologies over time. So I would like to look at engagement patterns of populations with these digital technologies, and are they more if these positive effects are more beneficial when integrated with in-person interventions. So I would like to design a study that sort of looks at both digital media use, but its integration with in-person interventions as well, and see how those would collaborate well together. Yeah, thank you.
That sounds great. So we're close to time. So to wrap up, I was going to ask, I think we've got Erza, Jyoti and Preetika, think about like a 30-second response. If I was to ask you, like, what is your number one, like most urgent recommendation that or action you would like to see happen to ensure that digital transformations can positively benefit young people's health and well-being? If you were in front of a policymaker or Mark Zuckerberg or someone like that, what's the top ask that you would make of them? So Jyoti, do you want to go first?
Yes, sure. So I would say that whenever any digital intervention is being designed, one has to make sure that inclusivity and accessibility has to be its core. So yes, that.
Nice succinct answer, thank you. Preetika, what would you say?
Yeah, I would push for enhanced research in the global south and funding and collaboration to sustain that because I feel digital technologies are growing in that area, but the research needs to accompany that as well. Thank you.
And Erza, I don't know if you're still there, but if you want to add anything.
Yeah. Honestly, there are so many things, so it's quite difficult. But maybe at this point, I would put more transparency and accountability on how our data is handled and how algorithmic transparency, or how do algorithms work in general, and does our data get kind of replaced with some codes or something, or yeah, whatever. But definitely algorithmic transparency.
Fantastic. So transparency, inclusivity, more research. We've got lots of things to follow up with as a result of all of this fantastic research that you've done for us, and Esther as well. Thank you so much to everyone who's joined today and to our presenters. I really do encourage you to read the full papers because there's so much sort of rich information and good recommendations coming out of all of the research that's been done over the last year. So thank you so much. We invite you to join the second part of our research dissemination series on the 5th of March, where we'll be learning about research done on digital first health systems, digital citizenship for health, and building trust in digital health ecosystems. And if anyone's interested in applying to be part of our next cohort of research fellows, look out on our website and our different channels in March. We'll be putting out a call for applications. And so with that, just say thank you again for everyone for joining. Sorry we ran a little bit over time, but it's been a really great presentation, and we look forward to everyone joining us again next week. Thanks so much.